was your day? Just curious. Oh, I think I have to be a host, Ruben, so I can share my slides. I think I have to be a host. So, hey guys, what's going on? How are you guys? We should be live on Facebook. Let me make sure we are. Type in the chat, by the way, if you're live or on replay, because I love seeing when you guys hop on for replay as well. I like to say hi to you, but I'm super excited because it's Wednesday, it's day 3, and I just got home from work too. I know you guys are all probably settling in from work as well, and thank you for making me host, Ruben. Awesome, thank you. I'm just thrilled and pumped because I've been seeing your comments. I've been getting messages from you guys, and it has been phenomenal getting to know you guys and getting to see you come out of your shell and make progress and guess. And I hope you guys liked last night with the arrhythmia bonus session that we had. Hi, Nuria. Hi, and I hope you guys like that because that Gary is just amazing. And we also have another bonus session tomorrow with Joe, who's going to do also some arrhythmias. So this is a treat. We don't normally have 2 arrhythmia bonus sessions, so I'm really excited about that. Also, one little quick note that I wanted to mention before we officially start our session, because it's not yet 5:30. Facebook made a change today. Facebook made a change, and it does affect our group. It affects actually all the groups that I host, which I thought was weird that they made this change, and I didn't get a message about it. I don't know if you guys did, but they moved the guides section. So they moved the guide section, and that's where we store our class recordings. So everything we've done in the past in this group and everything that we're doing this week gets stored in the guide section. So there's like a day 1 guide, there's a day 2 guide, there's a day 3, etc. Right? Well, they moved them, and I'm going to show you a screen of where they actually moved them to, so you can see it. Okay, so anyway, I'm going to show you that, but welcome in. It is now officially 5:30, so we're going to do day 3. And the great thing about today is the giveaway tonight is something pretty fantastic. Well, they're always fantastic, actually, because they are so much fun. And tonight's giveaway is actually a private Zoom session on, I believe it's Sunday, 7/3. I think that's a Sunday, with Coach Michelle. And I'll tell you more about that later. But I'm really excited to give that away tonight. We have some spots we'll be auctioning off at the end. And then tomorrow night is our big bonus prize where we're giving away a scholarship. So to our paid EKG program that starts next week. So you guys definitely want to make it for tomorrow's live. Absolutely don't miss that. Now, this is where the change was. I want to show you now that we have more folks on. This right here, this is just a little, quick snapshot of the group. I just took it right before I hopped on. And they used to have the guides right here. So it was like actually a button right here, but they don't have that there anymore. So I told somebody today, yeah, go look in the guides. And then I was like looking in the guides and I was like, I don't see it. So I frantically was like, what are you doing, Facebook? Is this just a glitch? What's going on? But it's actually up here now. So this little hamburger menu, I think that's what it's called. This is where the guides live. So if you push this button, that's where the recordings are of things we've done in the past. And then like tonight's recording will be stored there. But just know that even if you can't find that, we do actually have a replay page also. We just try to make this as easy as possible for you guys to digest the content. So we have an awesome replay page that we've also been giving out today. For anybody who missed any sessions, they will all go there, except for last night's bonus, because we are never allowed to record. Okay, anyway, going on, we also have a workbook. I think I mentioned this every night, but just in case you're new, a lot of people joined today too. So if you're new, that's okay. We have a little workbook, and there is, I'm putting the answers up for your homework if you chose to do it in the little chat here so you guys can see, right? W stands for wide wave. And I gave you the EKG here where if you wanted to practice like marking up the delta wave like I showed you on the screen, right? And the P, the short PR, where the mom stands really close to the QRS, and then the W, the delta, right? So W stands for wide QRS and also delta wave. You could check that out. So that was yesterday. And today we have another juicy case for you. They're all young people. And I don't know about you guys, but I have a special passion for young folks that get heart disease, because I know that we always say that young people can't have heart disease. Okay. So I love sharing these cases with you guys. And it's just an honor and a pleasure to maybe introduce you, if you're a baby Yoda, to some of these concepts, right? So you can tell we really love baby Yoda in this group. So anyway, let's do our case of the night. Let's jump right on into it. Now, again, this is not anybody's real face. This is not a real clinic even. I just actually built it. You can tell that I built it because there's paper charts over here. Hi, Megan, nice to see you. But again, this is a case that actually happened. And Tori's here in the chat saying if you need the workbook, put a hashtag workbook. Also, I have a question of the day for you guys that I want you to answer in the chat for me. It's not related to this case, but question of the day. If you worked today, what was your favorite case of the day that you saw? So type in the chat, what was your favorite case you saw today if you were at work? A lot of you maybe were not at work. My favorite case today was actually a 39-year-old who came in with all sorts of abnormalities on his EKG that were just delicious. And he had hypertension and hyperlipidemia and all this other stuff going on, fatty liver, all the things, and familial hyperlipidemia, I suspect. And I love that visit so much because he's young and we're catching all this stuff early so that hopefully we can prevent disease later and maybe change his life. So that's my favorite case, but I want to know, type in the chat, put your favorite case that you had today. I would love to hear it. Ooh, pericardial effusion. Okay, I'm super interested. Like, I love effusions. Anyway, so I'm gonna love reading this later, but going on to our case. Kevin, now he's in our room 4 and he comes in he has palpitations. Also my favorite chief complaint. So here's his mom bringing him in and she's like, I just want to be safe. Do you love when people say that, when they're like, I just want to be safe? Well, that's great and everything. We can only do so much in a clinic setting, but I think people think we can like pull things out of the air. Let's do a CBC right here, right now. Some urgent cares can, right? But if you're in cardiology or primary, you can't. So she's like, well, let's do something. I'm like, okay, yeah, let's do something. Let's get an EKG, of course, because we're in an EKG challenge. And we're looking at him and we get some vitals, which are phenomenal. And we're looking at him and we're like making a quick gut check. How sick is he, right? So I actually have a name for this. This is called the positive text sign. Have you guys ever seen this when a patient is like doing their thing and they're like, oh, I have 10 out of 10 pain. And then they're like texting. You're like, no, I don't really think that's a 10 out of 10. You have a positive text sign. Now that's not something to ever document, but you can see that and you're like, if you're 10 out of 10, you're probably not able to text sitting upright or eat a turkey sandwich. That's a whole nother story. But he looks good, but that is unfortunately deceiving in this case. Even though he looks great, there is something really going on wrong with him. And we need to find out what it is with his EKG and his history. Oh, yes, accompanies the positive Cheeto sign. Absolutely. Julia says, yesterday, she works in ophthalmology and she had a glaucoma. See, you just saved another life. That's awesome. I love hearing these stories. You guys are all my heroes. All right, so going on, let's talk about his history because we want to find out if there's any red flags. Okay, so let me ask you guys another question. How many of you have teenage boys? And the caveat to that is if you have a teenage boy, what are the chances that he's going to call you, his mom, to pick him up at school? The chances are probably pretty low because teenage boys do not generally like to be seen with their moms, right? Their moms are not cool. And if he's asking you to pick him up from school, then that's, a warning, right? It's a red flag. And he also said he felt like he was going to die. Now, maybe he's dramatic, potentially, but maybe he's not. So we're interested. And he also said, I felt like I had a racing heart for 30 seconds at 11 o'clock today. And his uncle died of something wrong with his heart at the age of 36. So how worried are you on a scale of 1 to 10 about this 17-year-old? How worried are you? 10's really worried and 0 is not worried. Hi, Lisa. Lisa Durso's chiming in. So cool. Yeah, let me know. How worried are you? Okay. Yeah, a 7. I agree. Does anybody else have anything different to say about that? Anything different? Let's see if our Michelle is on here yet. Don't see her. Okay, so I'm pretty worried too. I think 7, at least a 7, right? The uncle dying, Kimberly says 8. Yeah, these are good. So I have lots of 8s. I like it. Okay, so let's look at his EKG and then we'll revisit how worried we are. So here's his EKG. Finally got on with audio. Yay, Kelly. Yeah, I know. I sometimes listen while I'm driving too. I know, totally with you. So here's EKG, and you can see that the machine software says there's not a whole lot really wrong. Julia says 8 to 9. Okay, good. It's not a lot wrong. The machine says, oh, possible incomplete right bundle branch block, abnormal ECG, normal sinus. Okay, so we don't have a rhythm strip on the bottom, but we can say, yes, this is a P wave distinctly, okay? And the P wave, just to kind of recap really quick, let's talk about this. The P wave, we know it says there's a first, well, actually it doesn't say, but let's measure the PR interval ourselves, okay? So this is making our line on the R. And when we go over here, this P, it's not yet over 200. So maybe they're actually measuring from here, but either way, it's a borderline or possibly complete first degree block, okay? It looks to be a little bit longer over here if you measure. Let's see, we have to find one that lands on a big line, but at any rate, that's not his problem, right? So this still looks to be under 200 to me, anywhere I measure. But his PR is measuring a little bit longer than that. Even if that's the case, it's not what's going on today, okay? Tori, it's so funny. Tori is non-medical, but Tori, who is our concierge, she actually is doing the thing that I want you guys to do, which is pattern recognition. So we want you guys to recognize the patterns, and she's recognizing something right away. In the V leads, the skier was a big clue too. But let's talk about that. If you go over here, V1 and V2, there is something happening here. And the something that's happening is actually the, yes, we're not medical, but the team is amazing. We love you too, Tori. So the thing that's happening is actually right here. Okay, I'm coloring it in pink so you can see it, highlighting it. This looks like a ski slope, okay? And Michelle, Coach Michelle, who you guys met last night, she has this saying, if you can ski in the V's, it's a problem, right? If it's chilly in the V's, it's cold, it stands for something. And the first 2 letters of BRR are the thing it stands for. Now, a lot of you actually got this right. When I posted this case this morning on the 8 o'clock, everybody who guessed got it right. And BRR, it's cold in the V's. Exactly, right? So this is actually something really bad, but the machine doesn't catch it. This is brugadas, okay? And like I said, everybody who guessed, they guessed right. And the whole take home is that if you have in V1 and V2 ST elevation that looks like ski slopes like this with a wide angle, then it's probably brugadas. Now he has the history of a young person in his family dying of an atraumatic process. And that's also very concerning for something congenital like hokum or brugada. Both are life-threatening, but that's the pattern to recognize. And the other thing is sometimes the machine will call this a STEMI, but it's not a STEMI. It's a STEMI mimic because it looks like one, but it isn't one. And there's ST elevation, but no reciprocal depression. And that is really the take home of the whole night, that at the end of the day, you always for STEMI have to have 2 and 2, 2 up, 2 down. And also if you see this ski slope pattern here in V1 and V2, be very suspicious of brugada. Now, the machine is never going to say brugada. Okay, never going to say that. However, if a cardiologist overreads it, like for example, if this was done in an emergency room and they go back in and put their overread, it will say Brugadas or consider Brugadas or clinical correlation for Brugadas or suspect Brugadas, right? Barely anybody, I don't know if you've noticed this, but barely anybody commits anymore. Barely anybody in, radiology or cardiology or anywhere, they used to say right lower lobe pneumonia on a chest x-ray. And now it's like consider or clinical correlation, right? And no, have you guys noticed that too? Or is it just where I am in the world? Okay, Brenda says it's so true. Yeah, nobody commits. So they're putting the onus back on us for clinical correlation, which clinical correlation, we're pretty suspicious from his history, right? And he's definitely going to get referred to an electrophysiologist, and he's not. If I'm seeing in the ER, I'm not letting him go home because he has a high risk of sudden cardiac arrest. Yeah, everybody's saying in the chat on Zoom that yes, it's so true, and I totally agree, you guys. I'm glad it's not just me. So this little box here, V1 and V2, is the box where you're going to look for this finding, and anybody who is young, who is having any priority chief complaint, we kind of talked about that yesterday, but chest pain, shortness of breath, anything like that, you're going to get an EKG and you're going to look for this along with what we're looking for tomorrow night, PS, hint, hint. And also we're going to look for day 5's finding as well. Not so much in young people, but more in as we get older. They're all high risk though. And here it is, just another little beautiful example of a Brugada, and it will look like a STEMI, but it's not. And we're looking hard at V1 and V2 because that's where these findings are, okay? V1 and V2, the ski slope ST elevation. If you notice that last EKG said incomplete right bundle branch block, that's because it wasn't yet 120. It was under 120 milliseconds. So that finding, that Brugada, will oftentimes look like a right bundle, and there's a way to tell the difference, okay? So here's the way to tell the difference. This is like, nobody teaches this, which I'm so frustrated because I had to learn it, on my own, unfortunately. So hopefully you'll benefit from this. So a right bundle is what is presenting on the left. Okay, so you've got that RSR prime pattern, and you've got this, it doesn't look like I would want to ski on it. I mean, I would actually, if I skied on it, I would like hit here and I would just like fall. It wouldn't be a smooth path. But if I was skiing over here on the Brugadas one, you can see it's a lot more fun. There's a lot more, like hill here. And a lot of people say that this looks like a shark fin or a sailboat. But the problem with labeling the Brugadas that way is that there's other things in EKG land, if you say shark fin, that people start getting super freaked out about. And one of those is like an occlusion. This isn't an occlusion. This is a channelopathy. So even though I think it does look like a shark fin or a sailboat, don't use those terms. Just say it looks more like a ski slope, and that way you stay safe. So the Brugadas is wider than the RBBB, and that's how you tell the difference. The machine will usually only pick up the RBBB part, and it won't pick up the Brugadas part. If you have a machine that's ever printed out without anybody overreading a Brugadas, I want you to send it to me because I have not yet seen or heard of one. And if you do, I'd love to know. That'd be pretty cool. So what does that mean? It means we need to pick it up. It means we need to have the onus on us to never miss this again. So how are we going to do that? What's our systematic approach? If you guys like systems, because I know I do. Well, we're going to look for right bundle branch block plus the ST elevation, looking hard in V1 and V2 for those ski slopes with a wide angle. And then we're asking every single patient, every single young patient, and honestly, I even ask my older ones too, is there any family history of sudden death? And I ask them if it's traumatic or atraumatic. Okay, because if it's atraumatic, then I'm super worried about something congenital like Brugada or even hypertrophic obstructive cardiomyopathy. Okay, Mercedes said yes to systems. I know, I think everybody, when they're approaching EKGs or something that's really like hard, the systems are the things that save us, right? Oh, hi, Heather. I like, hey, everyone, I'm here. I'm happy you're here, Heather. So just to recap, right bundle or incomplete right bundle, plus that ski slope ST elevation, looking hard at V1 and V3, or V1 to V2, right? Sometimes V3 is involved. And then a family history of sudden cardiac disease or death that was atraumatic, they didn't get hit by a truck, it's Brugada's till proven otherwise. We're going to refer them. Now, actually, let me go back. Everybody always wants to know, what should I do with this hot potato finding? So nobody's asked it yet, but I know you're probably thinking it. Here's the thing. The hot potato finding that you get, if it's a whatever it is, right? Especially this, because they have a high risk of sudden death. You want to discuss with whatever physician you're working with. So potentially that is, someone you're collaborating with, like if you're an NP or a PA. But if you're in the field, you want to talk to the base doc, especially if a child wants to AMA, right? Or even a young teen. You don't want them to AMA. And if I'm working in the ER, I'm going to consult EP and say, hey, do you want to admit this patient and get them worked up? And if I'm working in the clinic, I'm going to talk to somebody higher than me, because that's how you deal with hot potato things. And I will tell you that there is no wrong or right answer here, because all the physicians I work with treat it differently. A lot of them are like, yeah, fine, discharge them, have them follow up EP. But the reality is we're rolling the dice. So if you're a mid-level provider, don't roll the dice by yourself. Get somebody else higher up than you to make that decision. And it's not a sign of weakness. I actually think that, I've been in medicine for, 14 years as a PA and 13 as a medic. And I still ask questions and I still ask for help, because I think that when you know your limitations and you see a hot potato thing, it's not a sign of weakness. It's actually a sign of you protecting your legal self and also protecting your patient. So don't ever fall to that. So Kevin, let's talk about the outcome on him. So he had a discharge of Brugada's. He was seen by EP. And Megan says she loves hearing me say that. Yeah, that just means you're a safe provider. And I know that I actually I want to just talk about that, Megan, really quick. I had a patient or a provider meet with me on a one-on-one session recently, and she was really stressed out because she said, I asked my doctor too many questions. And I was like, at the end of the day, it feels bad for us to have to ask questions and feel like we're bothering our very busy providers that we work with, right? But at the end of the day, you're doing it because you know your limitations and you're keeping your patients safe. And it's you have to just remember it's about the patient and not about how we feel or how that doctor feels even, right? And you go back to feedback from one of the attendings. Cool. All right. So this patient was diagnosed with Brugada's and an ICD was placed. That is the therapy to prevent cardiac arrest. And the patient will need close cardiology follow-up, because unfortunately, even with an ICD, it doesn't always prevent sudden cardiac death, even though we hope it does, because most Brugada patients will go into a VFib or VTAC, and they will need battery changes throughout their life. So his prognosis is guarded, honestly, fair to guarded, and we have to, keep a very close eye on him. So that was Kevin. Luckily, we checked it out, and we actually got that EKG, and we looked through the ski slopes in B1 and B2. Right. So that was a great case, you guys. Thanks for coming along on that one. And like I said, everybody who guessed got it right today. So I was super proud. And if you want to guess on tomorrow's case, it comes out at 8 a.m. and you can show up and guess and show your EKG prowess. And if you're wrong, that's okay too, because we're going to cover it in the evening at 5:30. So getting back to the giveaway of the night. Okay. So you guys got to meet Coach Michelle on, I think, last night. And she's so wonderful. You're going to get to meet her on Friday night again as well. But she's going to do a coaching session, which is going to happen on Sunday, the 13th. Ooh, Kelly just said something really good. I want to talk about this. Kelly said, my uncle is a malpractice attorney. Can't go wrong with putting case discuss with. Kelly, I cannot agree with you more. Yes, 100,000 times. Yes, Kelly, thank you for adding that jewel. I appreciate it. So getting back to Michelle, she is, like I said, she's a nurse of over 36 years, now retired, and she teaches EKGs for our program. And she's going to do a session for 10 people that are going to win tonight. I'm going to hop off after this and do the drawing, and you'll get to meet on a private Zoom with her. 10 people will. Yes, it is priceless. Priscilla knows Michelle very well. So you'll get to be on a Zoom and you'll get to submit questions before you hop on the Zoom to Michelle, and she will customize. You'll get like 10 minutes, right, where you'll get to have your question answered. and focused attention from her in a Zoom. So you guys will, 10 of you lucky winners will be on with her on Sunday. So the caveat is you have to be available on the 3rd at 3 o'clock PST. Otherwise, don't enter this giveaway. Wait for tomorrow night. Enter the scholarship giveaway for the 30-day program. Priscilla's in our 30-day program. She knows the goods. Now, so I'm going to be putting the hashtag in a minute for if you want to win with Michelle, and I'll be drawing those tonight. But definitely tomorrow. I just wanted to remind you, I know it's a long week, and I know you guys are probably tired, but come tomorrow night because we're giving away, like I said, a free 30-day scholarship to our 30-day 30 EKG challenge that we start next week on Thursday. This is priceless because what we do is we actually spend a month with you getting you good at EKGs. This is what the schedule looks like. So just to get your chops ready for tomorrow, right? So we do our welcome call on the 7th. We do terminology on the 11th. We have this bonus lecture. We have guests come in all the time. This is Carissa. She's going to do a sleep apnea lecture. She's a sleep NP. She's amazing. And then we're going to start here on the 14th. We're going to do a hands-on workshop where it's three nights, it's 3 sessions, right? Or I'm sorry, 2 sessions. It's the 14th and the 21st, where we do hands-on together. And we go over the EKG, we color code it, we talk about contiguous leads, reciprocal changes, and that's just with me. But you also get a 1.5-hour session with Michelle where she does her basic 12 leads. So you get all of that. You get on the weekend of the 9th, you get a basic arrhythmias lecture. And then you also get practice. So the 10-step system we teach you in this program, this 5-day, we actually have 2 practice sessions where we go through the 10-step practicing your systems, right? And then we have also something called study hall. We have our master David coming in, and this is where you can actually submit EKGs to David or submit questions, and he covers them in the study hall for you. It's so amazing, you guys, I can't even tell you. And then we have a study hall with me on the 31st. And then of course, we have our our lipid NP coming in, and she does lipid cases. So that's coming up on the 31st. And that's just the 30 days. You actually get access to all the recordings too. Are the sessions recorded? Yep, they're all recorded. There's one session we haven't scheduled yet, which is going to be Gary, who did last night. He's going to do the 12 lead session with us. I haven't yet booked him for a day. We're actually going to talk tonight about his day, but that'll be the only session that won't be recorded. We'll get plenty of heads up notice, but everything else is recorded because, as you can see, everything is basically around 4 or 5 o'clock Pacific Standard, right? So it is recorded, and you actually get access as a scholarship winner to our whole, everything we've done for 2 years in our group. So like if you want to watch the thing we did 2 months ago on stress tests or Holter monitors or like pacemaker, anything you want, AFib, right? You can watch it. So this is a good scholarship. We actually send you a box. This is the box, right? Full of the goodies, the workbooks, the colors, the tools, the RCAT window. We get you access to these 2 groups as our scholarship winner. You'll get access to the July 30-day EKG group and our Launchpad, where we do all the classes on Mondays here and all the classes on Thursdays here. These are all the basics. So like if you're just a newbie and you win the scholarship, you can go to our EKG Launchpad group and go back to like when we first started it in the guides, and you can go watch about like the paper speed. You can watch about how to measure time, how to measure waves, what wave is what. You can go all the way back to the basics in that. They're all recorded, and you'll get instant access as soon as you sign up. And then, you know, we also have like, you know, all these other, you know, classes that are in here as well that are just waiting for you. And then of course, just a ton of stuff. The value is like $999 for what we're doing for the scholarship, but you're going to get it for free. It's not obviously $999. We make it super cheap for you guys that don't win the scholarship. But we also have a cardiology nurse practitioner, Megan. She's one of our coaches, and she comes in. She did a chest pain guidelines update. She did a heart failure update where they just changed the guidelines in February. So she covers that for us, and she breaks it all down. And she's amazing too. So we have lots of guest coaches. It's not just me and Michelle. It's people like Whitney, who covered stress test. This Melissa Buchanan is amazing too. She covered behind the scenes of the cath lab, and she showed us all how to read the tests and what happened in the cath lab. And these are just guests that came on, like just wonderful people that we have in our group. And then we of course have study halls, right? So that's all super fun with us, and you can get your questions answered. Yeah, it's super nice, Julia. It's really, really nice. In fact, our scholarship winner last round, she actually just re-signed up to stay in our program for the next year because she's like, yeah, I want to continue this. So that was pretty cool. Her name was Julia. So we had a Julia who won last time. So this is our other two coaches, right? We have the Lipid Queen, Whitney, and we have our Sleep NP, Carissa. They both do kind of like a consult corner. And you can also bring questions for these ladies and they answer them for you. Like I give Whitney cases and she'll do cases and she'll talk about, you know, how to read lipid profiles that are more advanced, the new medications, how to get them approved. So she covers all the things. And it's really funny today because in our 30-day group, somebody posted in the chat, they tagged me, they were like, hey, Jen, when Carissa was doing her sleep apnea lecture, you were mentioning something about the tongue. What was that? And so she tagged me because I love Carissa's lectures. I'm like a sleep apnea master now that she's been training us. But anyway, here's all the coaches. We've got Coach Megan, who's our cardiology inpatient NP, sleep NP right here, Carissa, David, who's going to answer all your EKG questions, Sean, who pops in to do rhythms and heart blocks for us, Coach Michelle, who's always around if you have questions, who does the most fun basic EKG lecture that I've ever seen. It's hands-on. We have Coach Whitney, and then we have Coach Me. So you're going to get access to all of that as a winner. So I'm going to go ahead and put the hashtag in, you guys, and I'm going to do the drawing when I hop off. So the hashtag is hashtag Michelle. Easy. Hashtag Michelle. If you want to win the session in Zoom, okay, Julia, okay, Justina, I'm going to write all your names down so we can put you in the bowl. And I think what I'm going to do this time, if it's okay with you guys, I'm going to leave this Zoom running and I'm just going to hop right back on it. So you don't have problems finding me. So I'm going to write your names down so I can come right back on in just a few minutes and do the drawing. Adelaida, I see you on FB. So this, remember, is for a tutoring session with Michelle. Okay, so I got you, Kimberly. I got you, Brenda. So Kimberly Deller. I make sure we have a bunch of Kims. We have Wahid. So Wahid, I got you, Wahid. And Brenda, hope you're going to be in it too. Hopefully you'll be winning twice. Wahid. See, I'm a really fast writer. And Priscilla, I've got you. And Justina, I don't think I got your name. So let's do that, Justina. And let's see if there's anybody more. Anybody else want to win the session with Michelle? The session is July 3rd at 3:00 PST. It will not be recorded. It will just be with Michelle. Because so far, everybody who's put a name in is actually going to win. You have a couple more minutes. Masood. So Sobha Des, got you. Heather Wallach. Heather, okay, so remember you have to be available at July 3rd. And Ellie, okay. Kelly Daher, got you. And Nuria, okay. All right, now we have a fair shot because we have enough people to draw 10. And Kelly, got you. And okay, all right. Now, anybody else? Okay. We're gonna stop now and I'm gonna go ahead and do the drawing for Michelle's 10 people, you guys. Here we go. See, this doesn't take long at all. All right. Ready. Here we go. We're gonna do the drawing. At first I was working, then I realized in Eastern time. Yes, so it'd be 6 Eastern time for you. Okay, the first winner of Michelle's session, you guys, is Kelly D. Kelly D, you're the first winner. So Kelly D, find Michelle Barkley. Kelly Dollar, I just pulled your name. Isn't that funny? So Kelly, put Michelle Barkley, message her that you're a winner and she'll get you the Zoom and message her your questions. Okay. The next winner is Janelle. Janelle, you're the next winner of the Michelle tutoring session. Let me mix these up. So now we have 2. So Janelle, the same thing goes for you. The next winner is Soha Des. So Soha Des, you're the next winner. Message Michelle Barkley that you're the winner. and she'll get you the Zoom, but make sure to private message her. Our next winner is Priscilla. Priscilla. Yay, Priscilla. I know you were just saying how valuable this session was, and then you won. Brenda says, what time is Central Time? It would be 5 o'clock Central Time. 5 o'clock Central. Yes. Priscilla says, yay, congratulations. Make sure to message Michelle, and she'll get you the Zoom, and you can tell her what you want to learn. Our next winner is Janelle. Janelle, you are the next winner chicken dinner. So Janelle, I think, did we already have you in here? Oh, you already won, Janelle. So you won twice, so I'm taking your name out. Okay, so now we have Janelle, Kelly D, Soha, Priscilla. So we have 6 more winners. Ready, guys? Here we go. Winner number 5 is Nuria. Nuria, you are lucky. You get be on the Zoom with Michelle on July 3rd at 3 o'clock PST. Our next winner is Adeline. Adeline, yay, Adeline, you're number 6. So you're number 6. So Adeline, message Michelle Barkley. And our number 7, actually, that was a duplicate as well. So number 7 is Heather W., Heather Wallach. You also won the session with Michelle, yay. Okay, and finally, we also have Wahid. Wahid, you actually won as well. So Wahid, message Michelle Barkley. And our last winner is Justina. Justina, good job, you guys. Okay, so we have Justina, Wahid, Heather Wallach for 3, Adeline for 4, Nuria for 5, Priscilla for 6, Sobda 7, Janelle 8, Kelly D 9, and the last person in here is Kimberly. I think Kimberly D. Kimberly D, you're the last person in the winning winner chicken dinner bowl. So congratulations, you guys. Message Michelle Barkley, private message her for the Zoom, and congratulations to all our winners. We're super excited for you. And remember, tomorrow you also want to come to try and win, because that is, like I said, the scholarship to our 30-day EKG challenge, which is literally the best EKG class you'll ever go to. I think we have a hand raised. Sobda, do you have a question? Type it in the chat if you have a question. And then let me check the chat, make sure. Yes, so again, Michelle Barkley, go ahead and message her. And I think, and actually Tori is putting in her name if you need it. And we'll see everybody tomorrow. So yeah, Sobda, I'll let her know that you won too. So she'll probably reach out, but check your Facebook Messenger. That's where we communicate with you. Facebook Messenger. And Justina, yeah, message her at the Facebook Messenger. I'll be letting her know you won as well. But sometimes the messages go to spam, so you might not see them. So you just message her, and I'll let her know as well that you won, so she'll reach out to you. So don't worry, we'll get you guys communicated. And I will mention, yes, Priscilla, not a problem. And she might be even on this video. All right, you guys, I'll see you tomorrow. And congratulations to our winners. And thank you guys for hopping on. It was so much fun. I'll see you tomorrow. Okay.